Hi, I'm Dr. William Mitchell. I'm a urologist in McKinney, Texas. I was the first patient to use ProstateNOW in our practice, and I had no familiarity with the product at all. And so we were looking at the different information, and the question was asked to me, do you have anybody in your practice that you think might benefit from this test? And what I thought about then was my maternal grandfather actually died of prostate cancer at the age of 60. So I said, I think that I'd be a good candidate for the test. And so we did do the test on me, and it was positive. I had the ATM gene, which I had never heard of, which is a risk. And I also had a high genetic risk score, which is a separate single nucleotide peptide test that's part of theirs. And I'd been having, testing and PSAs, and my PSA had gone up very minimally. I mean, really, with my age and everything, I think a regular patient I might not have thought anything about, but that kind of led to getting an MRI, which led to getting a biopsy, which led to having an aggressive cell type, which led to, treatment. So I think the test really did benefit me and set me in that direction.
When we first heard the news that Mitch had prostate cancer, it really turned everything upside down. It was a rush, it was frantic, it was scary. We didn't know what we were dealing with exactly, but we knew that we had to move forward quickly. And in doing so, I believe with GoPath, we are able now to have moments together that maybe down the road we may not be able to have. So we cherish every day. We look at life differently now, now that we are getting older, and see that things change quickly in our lives, which makes you appreciate moment to moment.
I would say that ProstateNOW test really has changed my life, because it led me down a path of more aggressive screening and testing for what turned out to be a very aggressive Gleason 9 tumor. And my treatment results so far have been excellent, and I think that that's in large part from getting a head start from having this test done. Well, I think the biggest reason that urologists are hesitant to implement germline testing or these genetic tests is just we don't have any familiarity with it, or I certainly didn't. In the past, it's not anything that we really looked for. There wasn't any clear guidelines on how to implement it. In the past, the different organizations like the NCCN hadn't really even addressed this issue. Now that's currently underway, and they're looking at those things, but the actual patient group that really should be looked at with these tests just wasn't well defined with us. And the last thing you want to do is just order a test and then you don't know really even what to do with the result of it.
I am very grateful that ProstateNOW exists, and we had an opportunity to use it. You are your family's advocate as a mother, as a wife. So act now, get it done, so that you know what you're dealing with and what your family is dealing with. So decisions can be made, and peace of mind can be brought forth.